According to the CDC, about 1 in 54 children has been identified with autism spectrum disorder. To speak more on autism spectrum disorder, we're joined by ChristianaCare clinical psychologist, Dr. Suzanne Bauer, and child psychiatrist, Dr. Narpinder Mali, to talk about this topic and the Multidisciplinary Autism program here at ChristianaCare. Thank you so much for joining us today.
Absolutely.
Thank you.
So let's start by going over the definition of autism spectrum disorder.
Yeah, that's a great question. So autism is a neurodevelopmental disorder. So what that means is there's differences in the brain that then affect typical development. There's three main areas that we're looking for. There's social interaction, communication deficit, and then restrictive and repetitive patterns of behavior. So each of those has its own kind of components to it. When we think about communication, one of the things that we're looking at is not only their verbal communication, what they're saying, but also all those nonverbal parts of communication, your vocal tone, your eye contact, facial expressions, gestures that you're using while you're communicating. Are those integrated in a fluid way that we would expect? We're also looking at social interaction and that reciprocity with other people. Some individuals with autism might sort of monopolize a conversation, especially if it's about something they're interested in, or not have sort of a natural flow of interaction with others. There's also typically an impact on their ability to form or maintain friendships at an age-appropriate level across their lifespan. And then we look at restrictive and repetitive patterns of behavior. Those are what most people think of really of autism: repetitive body movements, maybe really intense interests in specific topics, difficulty with transitioning to new activities or changes in their expectation, and then sensory differences. So maybe they're overly sensitive to some loud noises or the way things feel, the texture, but sometimes kids really like to smell things or like smell their food before they eat it. And so they're seeking out different kinds of sensory experiences in a way that other kids typically don't. And so generally, those are kind of the broad areas that we're looking for in terms of an autism diagnosis.
And I referenced that CDC statistic at the top of this conversation, but how common is autism spectrum disorder?
So as you mentioned earlier, Megan, it is close to 2% of the population, which is 1 in 54 currently as per CDC guidelines. And the prevalence has been increasing over the last decade. And there has been questions asked like why the prevalence of autism spectrum disorder is increasing. One of the reasons that explanations I would say that have come up is because more and more parents, general population has been becoming aware of the autism spectrum disorder. Social media has been actively involved in raising awareness about autism. More schools are also paying attention to the children who are struggling with autism. And on the top, even more adults are also now wondering if they have autism spectrum disorder, which has never been diagnosed before. So I think keeping those things in mind, over the years, we have seen that the prevalence is increasing. And now currently we stand at 1 to 54.
And Dr. Bauer, you noted a few of these symptoms in your definition of autism spectrum disorder. But if parents are watching and aren't sure whether their child may be exhibiting some of those symptoms, what specifically should they keep an eye on?
Sure. So it's going to vary across the lifespan because, like Dr. Mali had indicated, autism is a lifelong disability or difference. It's really a neurological difference, but it presents rather differently across the lifespan. So in young children, we're more likely to observe delays in communication, isolation, odd or repetitive play with toys. So maybe only lining up your toys. Some kids like to watch the wheels spin on cars rather than playing with them in an imaginative way. And parents may also observe some of those repetitive motor behaviors like flapping their hands or pacing back and forth. So some of the more behavioral presentations are usually first noticed when children are very young. As children grow older, if they didn't really display those symptoms, their presentation might not really emerge until they're later because they have sort of the typical skills of that age. But as they get a little bit older, the other children start to develop social skills that are sort of beyond theirs. So then we start looking for, are they having trouble interacting with their friends? Do they tend to sort of monopolize play and only want to talk about their one interest or play in a certain way? Do they have some of that limited flexibility with other kids? We might now see more sensory differences, or they might be more pronounced, right? So if you have a little kid, they're probably a picky eater, right? And so that doesn't seem unusual when they're 3 or 4. But if they're 5, 6, 7, 8, we might be more worried if they have a really restricted diet, right? Or if they really will not wear their school uniform because of the texture. Now, when you're thinking about some of your teens or your young adults, we might be seeing more anxiety, we might be seeing more depression, because one of the coping skills many people with autism use is sort of imitating the people around them to fit in. And that can be really exhausting in terms of emotional and physical resources. And so while they appear to be fitting in well, it's really taking a toll on them, and they're realizing how challenging it is to fit in. And the result tends to be anxiety and depression. So like I said, I think the symptoms might shift over time, but if you're noticing any of these things and it's really not going away, no matter the support that you're offering your child, then it's important to think about this and think about next steps you could take.
And Dr. Molly, what are those next steps?
So as Dr. Power was mentioning, like looking for those signs, especially in young age, is very, very critical. If the parents are coming across any of the signs that we just discussed, the first gateway to begin with is to get in touch with your pediatrician. So you start from there. All the pediatricians are very familiar with the developmental signs that can be typical for autism spectrum disorder. They can do screening in their office, and if that screening suspects the diagnosis of autism, they can refer the parent to get their child evaluated from a specialist to get a confirmation for diagnosis. And then if it's a more younger child, older child, especially the school age, getting in touch with the school also is an important area to explore. Autism has a different types. One, there is an educational diagnosis of autism, and there is a medical diagnosis of autism. So staying in contact with the school is also as important to get the services for your child.
Now let's take a deep dive into ChristianaCare's Multidisciplinary Autism program. What does that first evaluation look like?
Sure. So the evaluation typically involves a meeting with the psychologist. So that's me. And I'll do a clinical interview. It's a pretty lengthy interview with the parent or caregiver, as well as with the patient. And we talk about their developmental history, their medical history, family history, and then all of those signs and symptoms that the family has been noticing. We want to get a really comprehensive view of the child in their environment, with their family, and what it's really like to have a day in the life with that child. Then we also do what's called the ADOS, the Autism Diagnostic Observation Schedule. It's sort of the gold standard of evaluations for autism. Now there's 5 different versions, and we decide on the version based on the child's age and their communication skills. So we're really specified in what we're looking for. We would expect a young child, we would be playing with them, and older children, we're going to have more conversation rather than playing with little toys. So it's particular to that individual. The family will also fill out lots of questionnaires to get a sense of any symptoms that maybe we didn't get a chance to talk about, or their skills in terms of the school or maybe in the community. We also invite the family to share those scales with their teachers so that we can get really a full picture of that child in all their different environments. All that information goes together into the report, and the family receives the report prior to their feedback meeting. I think it's really important that the family gets a chance to read the report, understand what the information is, and then come to a meeting with their questions. So we have a full hour to talk about, what does this diagnosis mean? What are the recommendations, and what should I do next? We also include lots of referrals as appropriate for that child, and it's individualized to the child, And it may be things like neurology, it may be things like a GI specialist if the child has any particular issues there, community resources, things like that, that are really tailored to what the family has reported to us. And then if other resources might be our therapeutic services or our psychiatric services within our program.
So Dr. Molly, if a child is now diagnosed to be on the autism spectrum, what services do you provide in your program?
So I think that's where the real journey starts. Once we have made the diagnosis, we are here with our families at every step throughout this journey. So once the diagnosis is given, we work very closely what the needs of specific family and specific child is. Based on the needs, if there is a comorbid psychiatric condition such as depression, anxiety, behavior problems, we tailor the treatment plan based on the needs of the family and the specific child. So we provide evaluations by a child psychiatrist to address some of these concerns, which can either just include therapy, psychotherapy, or it can, if there is a need of medications, we certainly have services for that as well. And then some of these children are not in the need for medications, but require more psychotherapy services. We do have therapeutic services where we provide different array of therapeutic services, such as developmental flow time therapy, cognitive behavioral therapy, to help the child to develop the skills they need to have a good quality of life and a functional life. In addition to these services, we have a very strong case management support for the families, where our case manager help the families from the beginning part in for scheduling the appointment and helping and guiding the family throughout the appointment process, and then connecting them with the community resources outside. Either if the child is in need for ABA services or speech therapy, occupational therapy, we certainly work very collaboratively with the different organizations in the community to provide services for the families that we care for. Within the organization, we have a certain set of services such as neurology, speech therapy, occupational therapy that ChristianaCare provide. So we collaborate with those departments as well to coordinate the care for the patients that we have diagnosed autism with.
And how closely do you work with these outside programs, specifically the school counselors or other adults that these students are seeing every day?
I think that's a great question, and it's one of the biggest assets for our program. We have advocated for our children and families very, very strongly. We have worked with the schools very closely to advocate for the needs of the child, tailoring to their specific needs, what they require in the school system. And we have done numerous meetings with the different organizations in the community to develop that relationship, so that the ease in getting these families connected with them, with these organizations outside is very critical for us. So we work throughout the lifespan, anywhere from a child as young as 12 months who needs services to the adult who are in need for services very strongly.
So right now, as you both know, vaccines are top of mind for a lot of people, be it the COVID vaccine or really other vaccines. And there's that rumored link between vaccines and autism. How do you address that?
So in regard to vaccines, there has been a lot of studies done, especially by CDC, to see if there is any correlation between the vaccines and autism. One of the studies that was done in 2013 really where they looked into the antigens that are the substances that are carried in the vaccine, and they measured the levels of those antigens in patients with autism and without autism. And so far, there hasn't been any data to support the use of vaccine, and which can probably cause autism. So families can feel assured and safe to take these vaccines because they are needed for the immunity and to prevent more infectious diseases. And look out for the autism symptoms anyways.
And Dr. Bauer, what is your message to parents who are dealing with all of this right now, may have children on the autism spectrum or now just going through this program of meeting with you?
Something that I tell families typically in the last meeting that we have is your child is no different today than they were yesterday before this diagnosis was determined. Every child is special and has their own gifts. Autism is a brain difference. And so there's going to be some things that are really challenging for your child that seem easy to other people, but there's probably some hidden talents that they have that might be very difficult for other people. And the same is true for everyone. The best thing that we can give any child is to have a family that loves them and understands them for who they are and helps them be the best adult that they can be. And a child with autism is no different.
That's so important. Thank you. And Dr. Molly, before I let you go, how can anyone get in contact with your program?
So it's very plain and simple. We have one number. I'm going to repeat it, 302-320-9108. Call the number. All you have to do is pick up the phone and call this number, and we are here to serve you.
Fantastic. Dr. Molly, Dr. Bauer, thank you both so much for your time.
Thank you.
Thank you.